There is an assumption that the Ministry of Health has focused more on the COVID-19 response at the expense of other healthcare services. It is upon this thinking that we moved around the country to have a feel of what is happening in other healthcare services in the wake of COVID-19. Health service providers, from the most critical to the less critical, are going on amidst the challenges of the new normal.
If we suspect that you have COVID-19, then we usher you to the place where you can take a specimen, and then we advise you on what to do.
We have put in place prevention measures, and once we come in, and once the patients come in, and try to follow them, the risk of contracting the disease is low.
Maternal health services top the agenda of continuity of health care.
A lot more focus also has to be put on the issues of maternal and child health. We are happy that mothers are still delivering in the facilities, but many more could have come. However, they are not certain that they will be attended to.
Most of our children, most of our mothers will continue falling sick, will continue coming to the hospital to deliver. So it is very, very important that we strengthen that continuum of care.
Now, if we all put our mind only on COVID, what will happen to pregnant mothers who want to deliver? Because we do not want to witness a situation where a pregnant mother goes to the facility to deliver, and that person is told that all the health workers have gone to fight COVID.
But again, even the 24-hour services as regards deliveries, these ones continued because we made sure that health workers were picked and delivered to their homes such that we could have a continuity of service.
On average a month, we get 250 deliveries on average. So, and 50 of those are delivered by cesarean section. Then another number, they deliver normally. And then there are those who come with other complications related to pregnancy.
Mothers have their own testimony on accessing maternal health services during the COVID-19 pandemic.
It was challenging at first time, at maybe the first 2-3 months. But after a while, we started hearing, like from the radio stations, we would hear once in a while the RDCs say, for you, if you just have your antenatal card and the date of visit, you're just sorted. No one will stop you.
The mothers, I want to tell them to come and deliver in this hospital, the regional referral, because the service is very good.
While launching ICU beds at the Antonde Hospital, Dr. Diana Atwene addressed one of the challenges expecting mothers face while trying to access health facilities.
The issue of extortion, the issue of asking mothers to pay before they get delivered or before they are operated. First of all, I request our health workers that every health worker must put on uniform. And the uniform must have a name. Even if it didn't come with it, but at least get an engraver or someone to write their name on your uniform. The patients, don't keep quiet, don't lament. I know that at the time when you are stuck, you have to give money. But you know in the law, the giver and the receiver, you are all corrupt. In the law, the giver and the receiver, you are all the same. You can be charged equally.
Immunization against killer diseases is essential, especially among children, as a safety guard against infection.
We've been doing immunization, protecting babies from 10 killer diseases. So in this COVID-19 period, we've really tried to continue serving, protecting our babies. So we try to observe all the measures.
Besides protecting children from killer diseases, children with respiratory problems are receiving services at Lira Regional Referral Hospital.
I am talking to my mothers, telling them that don't even fear. What you need to do, just get on your transport, come to the hospital. We are very ready to protect that baby, to help that baby survive. Even protect, you will not even get the infections. So what you do, bring for us the baby early or the patient early to prevent the complications that can usually arise due to late coming.
At times, maternal health services require facilities, emergency services, and this is an area that drew attention.
Emergency care services deal with all forms of emergencies, and COVID-19 is such an emergency where we are playing an active role. But the coming in of COVID-19 pandemic did not stop other emergencies from occurring. And that's why from the very onset, our plan for the response was twofold: to respond to COVID emergencies and also respond to the routine emergencies.
When we talk about emergency services, ambulances come into the picture. Do we have enough to support the continuity of care?
In the country, there has been 178 ambulances, and we calculated that out of these ambulances, about 80 of them will be used for response to COVID-19 emergencies, and the other would be used for the routine emergencies.
When His Excellency announced that all government vehicles have to be parked in the office of a DHO, we saw that as a resource, but because we also had ambulances, now what we did, we said those who are in critical condition would use the ambulances. Those that needed patient transport would be able to use the non-ambulance services. So within the metropolitan, we identified spots whereby these vehicles were prepositioned, and each time a call was made to the call center would then be able to identify the nearest respondent where this person was. And that's how we did the balancing, that we used ordinary cars to be able to transport the non-critical to facilities.
Blood is considered by many as an emergency, especially for maternal child health. Do we have enough in the blood bank?
We had to boost that strategy by use of some form of door-to-door publicity. We bought megaphones so our small land cruisers and small Suzukis could move in those villages, calling people, please come and save a life.
For children who need nutrition services, the Nutrition Center of Mbarara Regional Referral Hospital is trying its level best.
We keep measuring their weight, their mark, that's the arm circumference. They have picked interest in eating. Then when they are okay, they don't have any other complicated thing that is in them, then they are transferred to nutrition center, which is in Natasha. Natasha, they are just only to rehabilitate the mother that should know how to cook this food.
Due to COVID-19, the Nutrition Center is receiving children who are critically ill.
So because previously there was a lockdown, mothers couldn't travel to come for services. So it means they would come when the children are severely ill. And in fact, in this period, I think since March up to date, we still receive children who come as bad as in shock for the first time. But previously, they would come, but when they are not so severely like that. So because of the transport and the movement, it has been affected. They have started coming now, but like I said, they come when they are very sick.
Ndetsera mwana we na birazimbere face we amisho ebijere mikono kwankati ndebere banansi bamukoraho we nahate nende baramutse.
Health services for infectious diseases like HIV/AIDS have been brought closer to patients given the number of HIV/AIDS patients in Uganda.
We have close to about 1.4 million people who are infected with HIV in this country, who are living with HIV. So we had to plan effectively with our partners to work out mechanisms in which we could send back individuals to their most proximate health facilities where they could pick their drugs nearest to them, especially during the early phase where we had the total lockdown and the transport had become a problem.
Well, during the pandemic, we got a little challenge, but we received guidance from Ministry of Health on how to care for patients who are taking ARVs in our department, what they call multi-month drug refills. This way, we mapped people in their communities, those who were stable and have been on HIV care for a long time. So transport was offered by the implementing partners and Ministry of Health, and we could deliver medicines to those hard-to-reach areas. Where we could give those who are stable, we could give up to 6 months, 4 months, and 3 months.
Good news, however, is that despite the temporary closure of Entebbe Airport due to COVID-19, this has not affected supply of HIV medicines.
A challenge on the supply chain, because many of the drugs, we import them from outside, and they have to be manufactured, so you have to make sure that you have the APIs and all the ingredients which go into those drugs. Fortunately, the supply chain was not very severely affected, but nonetheless we planned in advance to make sure that we had orders made in advance of the usual timelines, but that also we had adequate stocks of drugs at the country level.
Besides existing care for HIV patients, testing for HIV has continued.
Our unit of QPPU, we have a strong team there, and we were able to order, but also to make sure we have supplies of all the commodities for testing, the drugs, the viral load and early infant diagnosis reagents, and the other laboratory supplies that go into the monitoring of the treatment programs that we implement.
We perform a number of tests like TB, diagnosis of TB, which is ZN, a gene expert that helps us rule out TB. We do malaria testing here, HIV testing, hepatitis B testing, and more other tests that are done here.
For tuberculosis care, screening tables have been set up in Kampala and Jinja to screen those accessing the health facilities.
So at this point, one of the interventions that we decided to come up with to use was called a cough desk. So this cough desk is meant to be on the gate to tap every person who enters into a facility and screen them for tuberculosis.
But the best questions we ask is that, do they have cough, do they sweat at night, do they have fever? And now that it's COVID time, we also include the question of flu, so that we can be able to know whether they have any of the symptoms that we are asking.
In Masaka region, the tuberculosis department continues to make follow-up calls of patients.
But we have tried our best to make sure our patients don't miss their treatment. Those we heard that are outside Masaka district, we have networked with our ROA facilities, we have called them. With the support from our regional IP, we have tried to make sure we attach them to ROA facilities so that they don't miss their dot. And we keep following them up on a weekly basis. We make calls every Friday to see those who missed their appointments and those who fulfilled their appointments.
With non-communicable diseases like cancer and diabetes on the rise, cancer services are up and running at Uganda Cancer Institute and Regional Cancer Center.
The Uganda Cancer Institute has been providing cancer services non-stop. We have not had any break, despite the fact that there was this issue of the COVID-19. But nonetheless, we decided to transform our services in a way which is in compliance with the SOP provided by the Ministry of Health and the government of Uganda.
We have a disinfectant there that is jik. Each patient has her own protective polyethylene paper, which she comes with, every patient comes with a polyethylene paper to put on top of this couch where they lie or sit for treatment, so that we avoid that contamination.
For people who have deformities due to non-communicable diseases and accidents, orthopedics at Mbarara Regional Referral Hospital are helping out in making artificial limbs. With facilities open for patients, an interface with the national medical stores comes in handy with medical supplies provision. Here teams can be found loading medical supplies.
Ever since the pandemic began at the beginning of the year, National Medical Stores has not closed its doors to its clients at all. We have ensured that the operations here continue to run. We have continued to run day shift and night shift here in operations, just to make sure that we can always make sure that the health facilities we serve continue to receive the essential medicines that are required for them. So as we saw many of the other agencies closing down, shutting down, we do recognize how critical essential medicines are to the health sector, and we have ensured that we have mechanisms here to continue to make sure that we can fill their orders for essential medicines and also be part of the response for the COVID outbreak that we have seen this year in 2020.
To ensure that supplies reach the intended destination, NMS has a tracking device. The Minister of Health, Dr. Jane Ruth-Acheng, and the Ministry's Permanent Secretary, Dr. Diana Twine, launched medical supplies delivery at Lira Hospital and Leantonde Hospital, respectively.
The Ministry allow me to congratulate you and congratulate the staff. Thank you. You do it. So with those remarks, I now declare this intensive care unit for warmth, but also for protection against the outside environment. This is also the light. But really, this is a big boost for us. 100 million plus with the renovation. That is really a big push for us.
Now that there are ready medical supplies and necessary health workers amidst COVID-19, disease prevention and case management is key.
Among the things on the continuum of health services is issues of indoor residual spraying, which was done because we saw that it could not wait. We also went and distributed nets, national distribution of nets. Also, we activated a reactive vaccination against yellow fever, so that we do not get such other diseases becoming a risk, or all those vaccinatable diseases.
Besides mass vaccination against yellow fever, the distribution of insecticides treated long-lasting mosquito nets is ongoing.
We realize that it is very important that we protect people with mosquito nets within COVID. First, to support COVID care itself. Malaria presents with fevers, and fever is the most commonest sign of COVID. Now, it is very important that malaria is treated within 24 hours, with or without COVID. Now, malaria, when it is treated within 24 hours, is simple. You just take tablets. But if it delays, it complicates. People will need blood transfusion, they will need a drip, they may convulse, they may get renal damage. So we made sure that the COVID situation notwithstanding, services kept running within the framework and the pillar of continuity of care.
COVID-19 prevention guidelines seem to be helping in the prevention of hygiene-related diseases due to hand washing and wearing of face masks.
But we have also had a very good push because of COVID in addressing some of the respiratory related infections. Prevention of some of these because of use of masks, because of social distancing approach. This doesn't only apply to COVID, but it applies to even other respiratory diseases.
A lot is happening to ensure continuity of healthcare services amidst COVID-19 pandemic, but what informs the success so far is the zeal and resolve of the health personnel. Prior planning and weekly meetings have been key in ensuring continuity.
So to coordinate this, we have a coordinating team at national level and at district levels. So at district level, there's a subcommittee of continuity of essential services, which is headed by the Director of Health Services, the DHO, in each of the districts. And at national level, I head it here, and it's co-chaired by a partner, UNICEF.
To help address continuity of healthcare services, the Ministry of Health recruited additional staff.
So additional staffs were recruited. In addition to that, from the very beginning, the Ministry of Health designated regional hospitals to be the points where they are managing COVID cases.
The availability of personal protective equipment gives extra confidence to health workers.
We are not working alone. This is something which we are working in collaboration with a number of partners which are working with government, and these are the partners working in the different regions. So key among the partners are UNICEF, the World Health Organization, the World Food Program, UNFPA, CDC, PEPFAR, USAID, Makerere University, and IDI.
We've had quite a number of stakeholders and people supporting us right from government, providing the basic PPEs that people need to have. So everybody has a mask, there's access to gloves, there's access to hand washing facilities, there's also access to hand sanitizer, alcohol-based hand sanitizer. So that's one, and this hasn't come from just one partner. We've had quite a number of partners: Seed Global Health, Rights, Southwest Uganda, Ministry of Health itself, that's the biggest partner, and that's their mandate anyway. And we also had supplies, we got support from the university.
But what government has done really is to ensure that we continue to purchase, because PPEs are continuously consumed. So what we are doing is to continue providing them with PPEs and other things like soap, like sanitizers, to make sure that they prevent infection, not only on them, but also for other patients.
With essential services up and running, the population can easily access services.
It is very, very important that we strengthen that continuum of care. Even with COVID or without COVID, we need to strengthen our facilities.
Really, as a healthcare worker, I know there's been lots of talk that there's not much going on in hospitals, and people are scared that even when they come to the hospital, they won't get the right person to look after them. So this is not entirely true. The teams have been divided into teams that are specifically dedicated to COVID patients, but also the teams that work with non-COVID patients.
I call upon the mothers to come because we are giving the service. We have not stopped because of COVID, and delivery will not stop because of COVID.
We are mandated by law to be able to serve the people of Kampala. And our facilities are open. Our facilities offer services at no cost. In case anybody asks you for any amount of money due to a service, please report to the nearest KCCA offices. Our services are free, our services are open. It is our role, it is our mandate, and we are there to serve the people of Kampala.
In general, I must say that services are being offered at all fronts. The general services are going on well as the specialized services.
There is a lot happening in the health sector aimed at strengthening health services provision besides attending to COVID-19 pandemic prevention. Some health services are up and running, while others are in the pipeline. This is because health is wealth.